Welcome to my channel, How to Increase Your Chances of Getting Pregnant overview. After they've made the decision to have a baby, many women try to do everything they can to conceive during their next cycle. But it's important to remember that getting pregnant can take time. A healthy, 30-year-old woman has only a 20% chance of getting pregnant each month. It's normal for it to take a few months or longer. If you're anxious to get pregnant, there are a few steps you can take to make trying more effective. Here's how to safely increase your chances. The basics. Your high school health teacher probably made it sound like you can get pregnant anytime you have sex. But in truth, it's a little more complicated. Each month, there are a series of hormonal changes in your body that cause an immature egg in the ovary to grow and mature. Every woman's cycle is different. This process takes about 2 weeks on average, beginning with a woman's menstrual period. Once the egg is mature, it's released from the ovary in a process known as ovulation. The egg then travels down the fallopian tube toward the uterus. The egg is only viable for about 24 hours once it's been released. If the egg is fertilized by a sperm cell during this time frame, the fertilized egg will keep traveling down toward the uterus. It will then implant into the uterine lining. The key is to have sex in the days before and during ovulation. That way, the sperm cells are in the fallopian tubes when the egg is released. This makes it easier for fertilization to occur. Sperm can survive in the female reproductive tract for up to 4 or 5 days. Getting the timing right. The best way to increase your odds of getting pregnant quickly is to make sure that you're having sex at the right time in your cycle. If you have regular cycles, you will ovulate around 2 weeks before your period. This means your fertile window will be the 7 days before your expected ovulation. If you have irregular cycles, it can be a little more difficult to predict when you will ovulate and when your fertile window will be. There are a number of techniques that you can use to more precisely pinpoint your ovulation and fertile window. Ovulation Predictor Kit. These kits are similar to a urine pregnancy test. You will urinate on the test strips every morning, starting a few days before you think you will ovulate. The test strips detect luteinizing hormone, LH. It surges right before ovulation. Once you get a positive result, check your test instructions for details. You should have sex that day and for the next few days. These test kits are available over the counter at your pharmacy. Shop for ovulation prediction kits. Basal body temperature. By measuring your basal body temperature every morning before getting out of bed, you might be able to detect, first, a very slight decrease, then a very slight rise in temperature for 3 mornings in a row. The temperature rise may be as little as half of a degree. This can be a signal that you have ovulated. Keep in mind that an egg only survives about 24 hours after ovulation, so this so-called fertile window may not be a good indicator of when you should have sex. Other concerns that this method isn't always reliable include different factors, such as infection, that can cause a rise in temperature. Some women also find it difficult to detect that rise in temperature. Cervical mucus changes as the ovarian follicle, a small sac in the ovary that contains the maturing egg, develops. Your estrogen level rises. This rise in estrogen causes your cervical mucus to become thin and slippery. You may also notice an increase in cervical mucus. As you start seeing these changes, you should begin having sex every day or every other day until ovulation. Once ovulation occurs, your cervical mucus will become thick and sticky. It also may appear cloudy. Follicular monitoring. If you're having difficulty tracking your ovulation using the above methods, you can talk to your doctor about your options. Some doctors will monitor you with regular blood hormone tests and ultrasounds of your ovaries. This will help you know exactly when your ovulation will occur. Positions, orgasms, and lube. There are a lot of myths about sex, fertility, and how to make pregnancy more likely. Some of these recommend different positions or keeping the hips elevated after sex for a period of time. Others claim that if the woman orgasms or doesn't, conception is more likely. Unfortunately, there are no studies that support these claims. The one thing you should think about is your lubricant. Certain products can decrease sperm motility and viability. These are important when trying to get pregnant. You'll want to avoid Astroglide KY Jelly Saliva Olive Oil. If you need to use a lubricant, try Pre-Seed Mineral Oil Canola Oil. These products won't interfere with your partner's sperm. Thanks for watching. Subscribe for more videos.